Good morning, Eastbourne. This is your local chiropractor with your daily dose of complete health. It's Patrick Hogg. So I was at a screening yesterday. So we're down at Dog Fair on Seaside Road. We were down there for about 4 and a bit hours, and we're just offering people free posture and health screenings so they could start to see what was going on with their alignment and see whether we were the right fit for them. So if we could personally help those people. Now it's interesting, a lot of people come over to our stalls with a pain or a problem, an injury, what have you, and then they've been diagnosed by their doctor as having some sort of muscle injury or strain or pull, which just isn't getting better, followed on the advice given to them. So when you have a look at a lot of these people, there are big changes in their posture and their alignment, there are big changes in their function, their ranges of motion, and they, like they say, are simply not getting better. But all of them want to ask the question of, is chiropractic the right fit for them, or is physio the right fit for them, or is osteopathy the right fit for them? And do chiropractors actually treat muscle pains? Well, let me just ask the question, and this really kind of takes us to what chiropractic really manages. But yes, by and large, we will have an effect on the muscle system. Now, when you look at chiropractic and the original principles and why and what we're doing, adjusting the spine is really to actually get the nerve system to function better and the joints to function better. Now, when we look at what inserts into the spine, this is all the muscles, the ligaments and the joints, which by and large, if you're getting the spine moving better, naturally you're starting to get the muscles and other things working better as well. But when you start getting the spine moving better, it also starts to make the signals from the spinal cord and the brain send signals better, which by and large, what controls the muscles? The brain and the nerve system. So if we can start to get those joints moving properly, the alignment better, and the nerve sending the signal better, as a byproduct of improving the way the spine is aligned and the function of those nerves, we will see improvements in people's muscle function. However, we don't necessarily treat the muscle directly. We may give some people some stretches or some exercises which will naturally improve on the muscles, but we wouldn't necessarily be doing loads of massage or trigger points. There may be occasions where we'll do those things, but generally, as a by and large rule, we will generally be working on the way that the brain sends signals to that muscle, and as a result, having a direct effect, as it may be, that those muscles may relax, joints may start to improve, strains then start to heal, and then that person can get over that problem. However, one thing that also many people forget is that they're trying to treat a muscle strain, and the reason that that muscle is consistently straining or not recovering is actually because the nerve signal to it is not working properly, and that can actually almost have as many detriments in that healing process. And you can try and exercise it and stretch it and massage that muscle. If the nerve is not functioning to that muscle, it will not get better. It will continue to keep straining itself. So sometimes you have to look the other way. You have to treat other things first before you then start doing the physio and the muscle work, which is the other angle you have to look at this from. That was your daily dose from your local chiropractor, Patrick Hogg, and we'll speak to you again very, very soon. Take care for now.